Good afternoon, everyone. I'm Paul Irwin, your Dean of the School of Public Health here at UAB, and I'm honored to welcome all of you to our Fall 2020 Kickoff gathering. In the two previous years, we've held this meeting in person, and although we're limited by COVID-19 this fall, I wanted us to hold this meeting in order to retain some sense of what is normal. This is our time to introduce newly hired faculty and staff, to celebrate new appointments, talk about where we are with our teaching enterprise, with our research, with our practice engagement, and what the fall semester will hold for us. I'm joined today by our associate deans, as well as Julie Brown and Maria White. Tessa Graham and Chris Sima are managing the webinar. Let's start with congratulating our newly promoted and tenured faculty. Leanne, Dustin, and Greg were all promoted to associate professor with tenure. Peter, Emily, and Sadeep promoted to full professor. So congratulations to all of you for those accomplishments. Professor Emeritus status to Pauline Jolly and Andy Rutz. This is in recognition of your career of contributions to the School of Public Health, and for this we're very grateful. Congratulations. For only the second and third times in the school's history, we have distinguished professors who were appointed this spring. Dr. George Howard and Dr. Virginia Howard were both appointed as distinguished professors in the School of Public Health. This is the highest rank, the highest honor that UAB bestows upon faculty. And again, before these appointments, we had only one other distinguished professor appointed in the School of Public Health. So congratulations to George and Jenny and for all that this represents. We also learned just this past week that Dr. Shauntice Allen received the 2020 Odessa Woolfolk Community Service Award. This is a UAB level, university level award that recognizes faculty for their incredible community service and community engagement. And certainly Shauntice is well deserving of this award. So again, congratulations, Shauntice, on this award. We have a number of newly hired faculty. I won't read out all of these names. You can see the names on this list. A number of new faculty throughout the school who were hired both this fall and in the spring. We have a number of new staff as well. And I hope that if you haven't had an opportunity to meet them in one way or another, virtual or real, that you will be able to when we get through this, this COVID pandemic, and we will get through this, that we will be able to celebrate in person all of our newly hired faculty and staff. So we welcome you to the School of Public Health and to this community that we have here. We also have newly appointed new department chair for environmental health sciences, Dr. Jeff Wycliffe, who is coming to us from Tulane and will start October 1st, just around the corner. And making note also of the new appointment of Jeff Walker, who is in the College of Arts and Sciences as the interim director for the Center for the Study of Community Health, our CDC funded prevention research center. And with that, let me turn it over to Julie Brown, who will talk about our School of Public Health Staff Council. Julie?
Thank you, Dean Irwin. My name is Julie Brown. I represent the Department of Health Behavior. I'm going to just introduce you to our staff members, talk to you about a couple new awards we have, and some upcoming events. So representing the Department of Biostatistics is Coretta Thomas. She's also our chair-elect. John Bessler is her alternate. The Dean's Office, Marcel Whittier. Corey Evans is her alternate. Environmental Health Sciences is Alan Holliday, who also serves as a rep to the Executive Committee. Laura Wilson is her alternate. Epidemiology is Mo Harbin, who's our treasurer, and Cassandra Johnson is her alternate. Lizzie Taylor represents HCOP. Ayana Underwood is her alternate. Paul Wolf represents the 912 building. Shamika Gillespie is his alternate. Representing our centers is Ariane Nassell, and she's our secretary. Katie Adams is her alternate. And we have 3 non-voting members, Joanna Carson, who was chair last year, and then Sabrina Hagan and Michelle Henry are the representatives to the university-wide committee. We're very excited about 2 new awards we have. One was at the idea of David Rhodes. It's our Shared Values Award. It will be awarded once a year. Faculty and staff can nominate a staff member. It will be based on this university-wide shared values, and we'll send more information about that out in the spring. And then every week you can nominate somebody for a peer-to-peer shout out, and we have information about that and get a handle. For more information, you can look there. We do meet once a month, and starting this semester, we started doing Tuesday coffee conversations every other week. We will continue that. It's been quite popular. And then we have a couple upcoming events we wanted to share with you. One is tomorrow for the staff. It will be a virtual scavenger hunt. And then in October on the 30th, this will be open to faculty, staff, and students. Instead of a costume contest, we're going to do a pumpkin carving contest, and we'll send more information about that. And now Dr. Austin will speak.
So I'm going to give a brief update on the educational mission of the school with the focus on enrollments and the new MPH core. So I'll start by talking about our enrollments. We've had a dramatic increase in graduate enrollment, up over 80% overall, and both our doctoral and MPH enrollments are nearly double what they were last fall. Now, part of this, of course, is due to the interest in public health due to the current global pandemic, and then also in part due to the slowing economy, also due to the global pandemic. But part of it is also due to very intentional and very strategic marketing and outreach that many people in the school have undertaken, led predominantly by Maria White. We're so happy to have her on the team. And then, of course, part of this is also due to the extended application deadline that we had for fall admissions. Now, we are not planning to extend our spring admissions deadline. It will be at the same time as usual, but we do expect that we're going to have another very strong semester of applications. And the departments will have to think very carefully about capacity as they make offers for spring admission. We have also launched the new UAB MPH core curriculum based on the evidence-based public health model, and I've included the graphic again so you have a reminder of how that model works. Currently, we're offering PUH 601 and 602, and PUH 603 will start in the second 7-week session. The PUH 601 course is called This is Public Health. And it's really focusing on developing a public health perspective. Now, this is important because our students come from all different disciplinary backgrounds. In that course, they're also learning about public health resources, really emphasizing the use of the CDC website, which has examples for absolutely everything you would ever need to know in public health. And the course also has a very intentional focus on public health research and practice here at UAB, in Birmingham, and in the South. PUH 602 is currently being offered. This is the community assessment course, and it introduces students to the various community assessment methods used to identify and prioritize community needs and to identify community assets and inform the development of public health interventions. And this course adds an emphasis on qualitative methods, which is something that previously had been somewhat uneven across the MPH concentrations. 603, the quantitative methods course, will start in the second 7-week session, and it will provide a basic introduction to epidemiology and biostatistics as they're used to conduct community health needs assessments. They'll really be focusing on developing questions to quantify the health issues in a community, in finding publicly available data that can be used to prioritize a community's health needs, and selecting and applying the appropriate epidemiologic and biostatistical analyses. And then most importantly, on communicating those results in clear language for community partners. In the spring, the second half of the core will launch with the Programs and Policies course, the Management and Evaluation course, and the Leadership course. And I know I speak for the other faculty who have been involved in the development of these courses when I say it has been So exciting and so challenging, but mainly exciting to really reimagine how we present this material to focus on what students really need to know when they go out into the public health workforce. We are always looking for more perspectives and experiences, so if you are interested in contributing to the core in the future, please reach out. And now I'll turn it over to Dr. Lisa McCormick.
So I want to start by giving everyone a snapshot of the MPH internships over the past academic year. So from fall 2019 through summer 2020. So despite the COVID-19 pandemic, 153 students were able to successfully complete their MPH internship over 119 different internship sites and logged over 32,000 hours of work for or on behalf of their internship organization. So that is really great because we did have a number of students that had to push their internships from summer until fall of 2020. The pie chart that you see on this slide breaks these numbers down by department, and underneath the pie chart you can see the breakdown of the number of students completing their internship by semester. The majority of our students, around 76%, are completing their internship with organizations in Alabama. 33 other students completed internships outside of Alabama in 19 other states. And we had 4 students that completed their internship with an international organization. That number would have been higher if it wouldn't have been for the COVID-19 pandemic, but that changed some plans of students, of course, when travel was restricted. By industry on the right side, 47 students are right at 31% completed their internship within the academic setting. This was a 9% increase from the previous year. And again, this is likely due to the COVID-19 pandemic and the fact that we had emergency guidance from SEEK that allowed students, more flexibility to do internships within academia. And then you can see the breakdown of the other remaining industries that our students worked in. So overall impressions for both students and preceptors' evaluations have been very positive. 100% of students agreed or strongly agreed that their experience allowed them to apply public health skills and knowledge. 97% of students agreed or strongly agreed that their prior coursework at UAB adequately prepared them for their experience. And we had 150 preceptors fill out the final evaluation, and 99% of those preceptors agreed or strongly agreed that the student was prepared to meet the goals and objectives of the internship. Another 97% agreed or strongly agreed that the host agency benefited from hosting the intern. So these are really good numbers. I'm really happy about these, and I think it shows the quality of work that our students are doing with our community partners. On the next slide, I just wanted to mention that this fall, we launched our new internship tracking system, which is called APEX. This system replaces the old intern tracking system that we had, InternTrack. So this new system is more secure and strives to meet some of the suggestions for improvement that we've heard from faculty and preceptors over the years. So we have 54 students who are completing internships this semester in the fall of 2020. And we used the new system. So it was piloted this fall with them, and they were able to complete their internship documentation with very few problems. So we're really happy about this system. Faculty and preceptors will be able to track students' progression through the internship, including the numbers of hours worked. And when you log into Apex, and these green dots that you see here on this slide is a status bar that allows you to track students' milestones through their internship. The DRPH portal is very close to launching, so there will be a separate portal within Apex for DRPH students. We're going to launch that later this semester. And then next, we're going to be working on an MSPH portal and an undergraduate portal so that we will be able to track all applied practice experiences for all of our students in this one system. So Mina and Elena are in the process of working with the departments to meet with all incoming MPH students to provide an overview of the internship requirements and answer questions that the students have about how to secure an internship and federal deadlines and the importance of MOUs. And so over the next couple of weeks, they will be meeting with those students in the departmental meetings. The image at the top right of this slide is our new internship website that launched this summer. The link at the bottom of the slide is how you get to that website. And there are going to be buttons for each of the different portals, the MPH internship portal, the DRPH practicum portal, and the MSPH and undergraduate portals when we get those. So that's just really what we've been working on really hard in the Office of Public Health Practice. And now I'm going to pass things along to Dr. April Carson, our Associate Dean for Diversity, Equity, and Inclusion.
Good afternoon, everyone. I want to provide a brief update from the Office of Diversity, Equity, and Inclusion. I'm really touching on a couple of key items. The first update is related to the education series for School of Public Health employees. So as we mentioned earlier this semester, with the full support of the executive committee of the school, we've embraced the expectation that all faculty and staff will complete the university's diversity education series during this academic year. We are pleased that everyone is committed to creating and maintaining an environment that will actively foster a better and more inclusive School of Public Health. So I just want to clarify what the expectation is regarding this. Although there have been several emails, I just want to bring to your attention what the expectation will be. So for this fall semester, the expectation is that the awareness at UAB module, the cultural awareness building blocks, and the unconscious bias workshops will be completed by December 31st, 2020. Again, you've already received much of this information via email and from your department chairs, but we just want to remind you about this expectation. The remaining courses, Safe Zone and Bystander Intervention, should be completed by May 31st, 2021. You may participate in one of the sessions that we'll be offering specifically for School of Public Health employees, or you may take one of the campus-wide offerings through the university's campus learning system and through the University Office of Diversity, Equity, and Inclusion. Again, we'll be resending reminders to everyone throughout the semester and throughout the academic year. So please check your email if you have any questions, or you can contact us at SOPHdiversity@UAB to ask questions. The next update is related to additional focus areas that have been identified by the school's diversity committee. So the School of Public Health Diversity Committee includes faculty, staff, and students with representation from all departments of the school. And so these focus areas broadly center around retention, curricular content, and the awards process. And briefly, just a little background about each of these. Retention, we've been talking about for some time now, specifically related to promotion and tenure of faculty, as well as some staff and student concerns that have been raised. So we are working diligently in those areas to see what processes and procedures can be put in place or revised to address any concerns there. As far as curricular content and expertise, as Dr. Austin's already mentioned, there's been a complete revamp of the MPH core, but we're also working to identify additional areas of growth, as well as what expertise may be needed to build out certain topic areas, particularly related to race, racism, and social justice. And then lastly, the awards process. This has been centered around making sure that there's an equitable process in the nomination as well as the selection process for particularly school-wide awards. And so we are collating information about that, and we'll be making recommendations to the executive committee soon. So those are the main updates from the Office of Diversity, Equity, and Inclusion. I will turn things over now to Dr. Muntner and the Office of Research.
It's really my honor to present an update on the Office of Research, our current successes and ongoing activities. So I'm going to start off with some recent successes. And as you'll see in the upper part of the slide, 3 doctoral students submitted F31 grants this summer. And this is part of the PhD or doctoral level grant writing workshop. And it follows up on our success of a workshop in 2019 where 3 doctoral students received American Heart Association awards, and the work of Madeline Gibson in helping the students prepare their grants. So really, it's a great, it just shows the great work of our students and the dedication to research. So keep our fingers crossed for these grants, and hopefully for students interested in 2021, this program will continue next year. We are on track to really, sorry, if you can go back a slide. We're on track to exceed our total research awards for FY20. So as of right now, we're at $33 million for our FY20 grant awards and contracts, compared to about $32.3 million in FY19. Now, we still have a few weeks left, and hopefully NIH will decide to make a few more awards before the end of their fiscal year. In the bottom of this slide, I just show some of the new grants, and these are just from the past 3 months. And what I like about this table is that we have a lot of faculty getting grants, but also diversity in the types of grants from NIH independent investigator awards like R01s, to supplements to grants, to foundation grants, and just a great diversity amongst our faculty and what they're applying for. And we'll, even though this was prepared on Friday, we just found out Friday afternoon that Ricky Tanner received an R56 from NHLBI, so just yet another grant to add to the table. But really, congratulations to all the faculty who are submitting grants. It turns out that we're up about 30% in grant submissions from FY19 to FY20, with 122 NIH grant submissions this year compared to 93 last year. And for those who know, or for those who don't know, the grants that we submit in FY20 most often get funded the next year. So this hopefully bodes well for FY21. A special thanks to Carol Mays, Paula Garman, Kip Phillips, and Virginia Harvard, and probably many other staff who I'm not mentioning, for all their work in helping with the grant submissions. So thank you to everyone. So in addition to grant submissions and research taking place, there are a lot of ongoing activities. We have the COVID-19 Journal Club continuing this fall. That has been very well attended. Lots of great updates on the different studies being published around COVID, but also we have faculty and staff from the school presenting on the activities that they're undertaking related to COVID. So if you're not getting the emails about this and you'd like more information, please contact me, and I'd be happy to send you information for these journal clubs. We're going to hold a state of research where I can provide more information on the current grants, high impact publications that have been done over the past year by faculty, staff, and students. And so we're aiming to have this in December after classes end for this semester. We're going to be having a virtual happy hour on October 5th to acknowledge and celebrate recent grant submissions. Hopefully next year in 2021, at some point, we'll be able to go back to having these in person. We're continuing to have faculty development lunches. So we have monthly lunches with new assistant professors, and these have core themes, including sessions focused on grant development and career development. And then we have quarterly lunches with more senior faculty focused primarily on career development. And then finally, I just want to put a word out for people who are conducting in-person human subjects research. Please let me know if you come across any obstacles that you need help navigating as you restart. I've heard from several faculty that they're beginning to restart their in-person study visits, and that's very exciting, but obviously we're in a new time. And so whatever support you need from the Office of Research, please contact myself or Madeline Gibson, and we're happy to help. And with that, I'll turn things over to Maria White.
Hi, everyone. So if I have not had the chance to meet you yet, my name is Maria White, and I am the Communications and Events Specialist for the UAB School of Public Health. I actually started this position 1 week before COVID. So I worked at Riles for a week, and then I went home on a Friday and I didn't come back. So I know I've only gotten a chance to meet a lot of you virtually, but just wanted to take a quick moment to say thank you for welcoming me in and how great it's been to work alongside you in such strange times. So just wanted to give a couple of updates on what my role entails and kind of tell you a little bit about what the new part of communications and events looks like for the School of Public Health through my position. So first, I am the internal liaison between the School of Public Health and UAB's University Relations, UAB Marketing, and the PR team for the university. So that means that every week I'm attending meetings led by Jim Bakken and Rosie O'Byrne, really hearing from firsthand from their office and from the provost as well, what is happening across campus, across UAB medicine. So that those meetings also include the whole hospital side as well. So it's been really cool to kind of sit in and understand what's happening under UAB as an umbrella, as a brand as a whole. So we do get to understand more about what's being said about UAB in the news, parental concerns, patient concerns, what are our students doing, what are they not doing, and we get to cater our messages that way. So that's really where I come in as far as the liaison between UAB's brand as a whole and then our school. I also handle event marketing and promotions for the school. So I know I've worked with a good bit of you to promote what probably used to be a lot of in-person events, and now they are virtual. So lots of seminars, lots of webinars, lots of great panelists and speakers coming in to talk on different topics in your departments. But where I come in is helping to promote them. So hoping to gain attendance through these promotions. If you don't already have a graphic to promote the event, you can reach out to me. I can set you up with a great template, help to equip you with a design program that we all have access to called Lucid Press, so that you can create different graphics that fall under our UAB brand in a really easy way. So if we haven't spoken about that already, please reach out to me because I'm happy to help. And my goal is to help your events succeed and help people, whether that's the public or our colleagues or, the Birmingham community or just students. We want them to hear about your events, and we want to help your attendance grow and certainly not suffer in a time when everything is virtual. And so one major way that I do help to promote your events is through social media. The School of Public Health is on the 4 major social platforms. So that's Facebook, Instagram, Twitter, and LinkedIn. As many of you know, they're all very different and they have different audiences. So Facebook is really where our alums, where our colleagues, and where our parents are. We have some students on there, but it's really a way to kind of, be represented to the public for those audiences. Instagram is where our students are, so it's important that every day I'm updating our stories to help share about your events, and then also, sharing a lot of student-facing content that they would relate to and try to encourage their participation and their interaction. Twitter is going to be a little more news-heavy, so that is lots of mentions of the great papers and journals that are coming out of our school. Anytime we're in the news, it's typically going to be on Twitter. And it's a lot more, Q&A between our faculty and staff who are really active on there. So that's a place where we have a really good presence. And then LinkedIn, of course, is going to be a lot of alums, colleagues, and then students looking for jobs. So just wanted to kind of update you guys on what I'm doing in that realm as far as social media. Another digital platform that I handle is our media screens and Riles. So if you see something in the building that you'd like to change, or you have an idea or something, please talk to me, because I do handle those and want to keep them fresh and interactive. And that is something that I'm handling now. And then also our campus calendar. So another way to grow attendance is through our campus calendar. So all of these requests can be submitted through the digital media request form on our website. And if we haven't spoken yet and you need help promoting your events or sharing with the public what you're doing, please reach out to me. I'd love to talk to you further. And then I also handle event planning for the Dean's Office. So right now that looks like a lot of virtual events. We had a virtual graduation celebration in the spring that was really well attended. And then For the Public's Health happened last week. And as most of you know, that is our white coat ceremony for our graduate students. It's really special, and it was neat to get to host it virtually and not have to sacrifice that for this class. We had 174 students attend, so that was really exciting. And then about 40 faculty and staff. So thank you all for taking the time to jump on there. And if you got a chance to watch, it was really special. Our students got to see some alums, got to recite the Declaration of Commitment to Public Health as a group, and it is recorded. So if you're interested in watching that, please reach out. And then also today's event. So you'll be seeing a lot more of me, I'm sure, in the future, but wanted to kind of cover what events look like. I also handle any tracking of our media coverage. So for a lot of you who are experts in your field, which is the majority of our school, I'm very impressed coming in here, especially during a pandemic. I feel like I have learned so much. You guys get tapped by the media all the time to give interviews and quotes on what's happening in the world right now. And typically it's Holly Gaynor who handles the School of Public Health as far as media from the PR team internally. Right now it's Bob Shepard, because Holly is on maternity leave. So if you have not looped Bob in when you have a request, please do so, and loop me in as well, because I do capture all of the media coverage afterwards. So we like to keep our SOPH in the news sections on both our COVID site about COVID related news, as well as our main School of Public Health website, news and events page. We like to keep that up to date as much as possible. I like to share about it on social media and really brag on all that you guys are doing. So just make sure to keep us in the loop on that. And kudos to all of you who have had some great placements. It's very impressive for our school, and all of that contributes to a growth in admissions. And then that leads me to another very large project that has happened this spring. I handle website edits and updates. And so, as most of you know, this spring we launched our new School of Public Health website. And I cannot take credit for this. Elena Kidd, Jenny Harvard, Leanne Robertson really worked hard with plenty more people as well alongside the UAB web team to execute this transition from Drupal to Joomla. And we are now on the same platform as the rest of the school. We have a beautiful website. If you haven't had a chance to really browse it and dive in, take a look. It's a lot more interactive and very mobile friendly. So it's a great public facing representation of our school. And if you have any edits to the website, please send them to me via the digital media request form. I want to make sure that each of your departments, each of your teams, each of your roles are represented accurately. So, I've had a couple of people reach out and say, I just want to reword this, or I don't love the way this layout looks. Let me know. I can work with you. I want to make sure that everything that you see online is representing the work you're doing accurately. So that is kind of my update. I did want to turn it over. If anyone has any questions, you can submit them into the Q&A box. And we have all of our panelists still on and able to answer questions if you have them, as well as Dean Irwin. So I will just give it a minute if anybody would like to submit.
And someone asked, can you explain what makes COVID-19 different than the flu? We can spend a little time talking about that. I will say, generally speaking, it is different from the flu in that it is more contagious, and that if you get it, you are more likely to to experience a severe illness than you would if you had the flu. Those are two of the most common ways that it differs from ordinary flu. One of the concerns that we have, of course, going into the fall is that we're going to see an overlap between both COVID and flu, and that will pose even additional challenges for us. It is one more reason why we would want to emphasize the importance of having everyone get their flu vaccine this fall. So that's a really important way to help protect yourself. Will flu vaccines be offered in Riles this year? I'm just looking here. Leanne, do you know if we'll be able to actually provide flu vaccine out of Riles building, or if those vaccine opportunities will be outside of Riles?
I think they will once again be outside of Riles in the common areas, probably the Hill Center. I saw something recently, and it wasn't employee help, but there's already a schedule of it, and we can get that out to the school.
Okay, thank you.
Yes, they're already taking appointments at the Community Health Services building. They'll do an appointment every 15 minutes to give out flu shots. And they started this week every Tuesday and Thursday. And there's a link off the main website so that you can make your appointment.
And I think it was in last week's UAB reporter.
I do know that UAB centrally is going to be doing a lot of push for the flu vaccine because there are some misconceptions about not needing to get your flu shot this year. So you'll probably see a lot of that around campus. And then, as Lisa said, I know that appointments are available, so we can now get them.
And that will be one way of also helping to distinguish between COVID and the flu, because if you get your flu shot, you're much less likely to get the flu. So if you end up with a flu-like illness, it might indeed be COVID. Can we get PPE on every floor near elevators or doors, hand sanitizer particularly? We certainly have hand sanitizer throughout the building, Kate. Leanne, do you want to comment on other aspects
Sure.
of the question?
Of course. We were initially constrained by the availability of hand sanitizer. Now that we have an unlimited supply in the filling stations, which are located on the first floor of Riles and also in the parking garage, we have what's supposed to be an unlimited supply. So employees are encouraged to bring their own containers and fill them up, because what happens is, well, we don't have access to dispensers to put out on every floor. We have some spray bottles that we could put, I guess, on the floors, if you think that would be helpful. We did put hand sanitizer in spray bottles in every break room last week, which are pretty close to the elevators. But if anyone, I do have a limited number of personal sized hand sanitizer bottles. So if anyone is interested in getting one, I can give you one to fill up at the hand sanitizer station if you would like to keep one on your person. In the past, when we have put out containers, just bottles, they tend to disappear. We do have some students who are putting them out in the spray bottles.
Certainly, if there are specific items that you need, please let us know. Anyone, please.
And your department administrators should be able to help as well.
Maria, we have a question about the virtual break room.
Yes, I'm so glad you brought that up, Robin. I can send a survey to the school and see if there's interest to join and restart this event. Really, attendance just fell off. The last 2 or 3, there was about 3 people. And I think that probably has to do with the nature of so many meetings. And I know we've all experienced that during COVID. I would love to reinstitute this. And if there is interest, I can absolutely make it happen again. We were doing it via Teams, which was a really fun way to host these, because you could drop in content and share, kind of non-work related content. So I will send a survey and kind of garner interest from the school. And if you guys would like to restart it, I think it's a great way to keep everyone seeing each other regularly.
I will comment while we're waiting for additional questions that there have been other recent awards as well. I know that April Carson and Susie Davies received the Graduate Dean's Mentoring Award, so congratulations to them. We will be celebrating all awards from the school in the spring. That'll be the focus of our spring school-wide gathering. It's to celebrate awards. Well, seeing no additional questions, I will wrap things up. Again, I want to thank all of you on the panel for your time and your contributions to the fall kickoff. Thanks again to Tessa and to Chris for managing this. I want to reiterate to all of you how much I have appreciated all of the work you've been doing during these unprecedented times. It has been a real honor for me to serve as your dean during the greatest public health challenge that any of us has ever faced. It's times like these where the true spirit, the heart, and the commitment of the School of Public Health comes out in abundance to confront the pandemic. I will say that because of how the School of Public Health has been engaged across UAB and the UA system, and especially with the Jefferson County Department of Health and the Alabama Department of Public Health, our school has gained in stature and recognition. From the webinars focused on vulnerable populations led by Sean Teese and Faith, to the data modeling from Jerry McGuinn and Suzanne Judd, to the daily tracking of data by Andy Rux and Jack Duncan, the many task forces and advisory groups and committees involving our department chairs and associate deans and other faculty and staff, the Sero survey work led by Eric Ford, the case investigation and contact tracing work led by Andy Rux and the survey research unit, and the incredible financial management led by Leanne Robertson through the most financial and challenging time at UAB. I can go on and on. Thank you, thank you. You are making a difference at UAB, in Birmingham, across the state and the nation. We will continue to be challenged throughout the fall. Perhaps the biggest challenge will be complacency and COVID fatigue. We can't let up though. We must remain vigilant. We must keep up our efforts and practice the safety and protective measures that will keep us all healthy. Please take care of yourselves and your families. Thank you again for joining us this afternoon, and go Blazers.